After surgery, I'm afraid of what it looks like. I'm afraid of the scars. I'm afraid of looking down and seeing something that's foreign. I'm more emotionally afraid. I found a lump in my breast on my birthday, October 25th, 2014. My boyfriend and I had gone away for the weekend, and I just kind of touched my breast with my hand, and I felt a large lump on my breast. To me, it felt like a golf ball, and I knew it wasn't okay.
Since last fall, Chiara D'Agostino has been navigating a frightening new world.
Depending on which doctor you talk to, I have either stage 2 or stage 3 breast cancer. It's in my left breast. I finished chemotherapy. I did 4 months of chemo, and I ended it February 27th. I'm going to have a single mastectomy on the left side.
Side effects during radiation are tiredness. You're already beaten up as a patient. You've had chemotherapy, you're having surgery.
But the former Italian teacher from New Jersey is also considering a further course of treatment. Surgery to have her healthy right breast removed too.
I'll have radiation, and then about 6 months later, they'll put implants in both my breasts.
Nice to meet you.
Nice to meet you too. Thank you very much.
That puts her right in the middle of a growing trend. There has been a sharp increase in double mastectomies, even among women like Chiara, who are at low risk for developing cancer in the other breast and are not genetically predisposed to breast cancer.
So this is a 50-year-old woman, and she had a lumpectomy, I think, back in...
What we've seen in the last decade or so is a downturn in the number of women choosing to preserve the breast and an upturn in the number of women choosing actually to remove both breasts in the setting of just unilateral breast cancer. Or in other words, they have breast cancer in the right breast and they'll choose to remove both breasts for the management of that breast cancer, when in fact they could actually save both breasts and just undergo a lumpectomy.
A study at Stanford University of 190,000 California women with cancer in one breast found that the number who underwent double mastectomies jumped from 2% in 1998 to 12.3% in 2011. The increase was even more striking among younger women aged 40 and under. In 1998, just 3.6% chose to have both breasts removed. That number soared to 38% by 2012. The research also shows something else.
When women choose to remove both breasts, there is no survival advantage to that approach. They are not going to live longer from the breast cancer that they currently have.
The procedure does eliminate the small chance that cancer will return in the remaining breast. But the surgery does nothing to prevent the cancer from spreading elsewhere in the body.
Removing both breasts doesn't prevent their first breast cancer from recurring in their bones, for instance, or in another organ system.
A number of factors have contributed to the surge in double mastectomies. A 1998 law mandated government and most private insurers to cover the reconstructive surgery. The doctor-patient relationship has shifted, leaving the choice more in the hands of the patient. And advances in plastic surgery promise more attractive artificial breasts than ever before. But surgeons say that can come at a price.
Second-sided breast surgery has an increased risk of complications compared to a single-sided breast surgery. So not only are they removing the second breast, they're increasing their risk of surgical complications. For the patient, this is often seen as a trade-off, as a way of reducing their cancer fear and eliminating their anxiety.
Anxiety that the cancer will spread to the other breast. It's one of the main reasons women say they're choosing double mastectomies, for peace of mind. Jennifer Finkelstein is the co-founder of 5 Under 40, which helps young women diagnosed with breast cancer. 5 years after a single mastectomy when she was 32, she decided to have her healthy breasts removed, against the advice of her oncologist.
It's such a personal choice. It's, for me, it's all about living and breathing and not having to look over my shoulder. Is this going to be the day that the doctor comes in the room and closes the door and says, we got to send you back to the breast surgeon for a biopsy? When is the shoe going to drop?
I think it's very difficult to make the decisions when you're facing a cancer diagnosis. I like the idea that most women have these options. I am a little concerned that women are choosing bilateral mastectomies out of fear. I never think you should make a decision for this kind of surgery out of fear.
The gut reaction for a woman who's been diagnosed with breast cancer is my breasts are my enemy, take them off, I just want to be done with it.
For Chiara, there is something else that she's been worrying about.
I certainly didn't want to have a mastectomy. I would have chosen to have kept my breasts, but the doctor recommended, 2 doctors strongly recommended that I get a mastectomy. And when I heard that, I pretty much decided that I wanted symmetry.
I am Sherry. I was diagnosed with stage 4 this past summer. Had no chemo, no radiation, no surgery.
Once I made the decision to have a double mastectomy, I was still terrorized. They recommended the mastectomy because they said that I had 2 tumors in one breast. I was scared of what I would feel like once I looked at myself in the mirror after the mastectomy. I was afraid of waking up in the hospital. I was afraid of how it would affect my sexuality.
It took me over a year to get back into being very loving.
Into feeling like
there's no
like
feelings.
a loving. Yeah, there's no feeling. That's
no feelings at all. You have to find your own way to have an orgasm and to feel satisfied.
I almost feel like I want to say goodbye to it, like before I go into surgery.
And you can maybe when you're ready to.
It's a hard decision for me. I have sensitivity in my breasts. I like that, I feel I'm a very sexual person. I like to have my breasts, but at the same time, I'm an aesthetic person. I'm a visual person.
I think it's very important to talk about loss of sensation. I think it's very important to talk about that there will be no more sexual stimulation from the breast, that they will always be aware of their breasts, or more often than not, they'll be aware of their breasts as something heavy sitting on their chest.
We never promise normal-looking breasts. A woman that has a nipple sparing or saves the nipple at the time of their mastectomy does not allow them to have any sensation with the nipple. So although it may look quite normal, in fact it is anything but normal.
I think it's all about choice. There is no free lunch when it comes to mastectomy and reconstruction, and I tell my patients that. There's a price to be paid for it because it's no longer your breast tissue. But you can look and feel comfortable with your body and feel that you made the right decision.
Thanks for coming. Thank you. Hi, Greer.
How are you?
I think I'm going to have a lot of fears and a lot of questions in this week leading up to surgery.
You're going to do great. You are.
I am staying in close touch with other women that have had surgery. I'm just going to stay close to survivors and hope that I can find some comfort in their success stories. I might change my mind and say, you know what, I want to keep my right breast. I don't know. I have as much time as I want, I think, to decide. But right now, I had made the decision that if I have to have a mastectomy, I'd like a double.
So we're doing today a left total mastectomy. We're going to take the nipple-areolar complex, all of the breast tissue. We're going to take out some lymph nodes, and we're going to test those. Then those are going to be tested if they show tumor in it or if there are lymph nodes that look abnormal. I'll be taking those as well. Okay.
I'm afraid of some of the side effects. I try not to think of that.
The first time is always the scariest time.
I think anytime you have surgery, there's a lot of anticipation, a lot of fear. That's totally normal. But you have a really good team and everybody's going to take really good care of you.
I would say the hardest part for me is recouping from surgery and making sure that I'm in a safe, peaceful environment.
I'm really overwhelmed with the response you had to chemo. It was amazing.
Oh, good.
It's really phenomenal.
Okay.
The lymph nodes were negative, the breast was negative.
Yeah.
There was no cancer left in it. It's phenomenal.
I actually got good news from my pathology report. My pathology report was clean. They took 6 lymph nodes out and they were all clean, and the tissue in my breast was all clean. Therefore, I don't need radiation, so this was all good news. However, after surgery, I came home and I had to lay on pads because I was still leaking. I had 3 drains coming out of my chest, like 3 plastic tubes that had these, big drains full of blood that I had to empty twice a day.
Right. And so we're fitting you for how you look now. I don't know how you're going to end up. Are you going to augment your right breast at all?
I had a lot of emotional healing to go through. So it wasn't as cut and dry as it's great news, yay. It was more like I feel like half of a woman. This almost still looks bigger.
Let me see. Well, let's see how it looks when you have, it does. Let me see how it looks with your tongue.
Because we are trying to practice patient-centered medicine, which means patients do have choices, and their choices may not always be what we think is medically the best choice or the medically necessary choice, and we have to respect that in the process of counseling them.
In Europe, they have the same clinical data available as we do. There's not any higher risk of breast cancer in the United States than in Europe, yet the rate of a prophylactic mastectomy in the United States is much higher. This underscores the fact that what we're seeing in the United States is really a cultural phenomenon and not really based in any scientific data.
I also had follow-up appointments with my plastic surgeon. He's the one that I see most frequently now.
Hey Kiara, how are you? How are you feeling? Any issues from last week?
No, I don't think so.
And he will look at the site and tell me that I'm healing well, and he'll take off the bandages and change them, but he's also been expanding the site.
Because eventually we're going to get to the mastectomy on the right side, eventually.
I did pause for a moment and think, would I like to keep one since sensation in my breast is so important? But then I felt, will I feel lopsided? Will I always be reminded when I look in the mirror, here's one breast and here's the other? I know it's more surgery. I know it's risky. I know it's more time. I know it's more healing. I hope that the next time I won't be as scared. It's a decision that I have to make. The doctors don't make it for me. They did tell me it's not medically necessary, and I'm still choosing to do it.